Thank you. Good morning, everybody. Who's here for their very first Academy meeting? Let's see a show of hands. All right. Now, remember the day you were here. You got 4 hours of free Academy training. This will never happen to you again in your life. So soak up every minute that's going to happen during the next 4 hours. It's a wonderful opportunity to be here. I'm grateful to the committee, to James and to Roma for putting everything together, and Nisha for executing it so wonderfully. You're in for just a spectacular day. And I hope we're able to share important, powerful information that will enrich your careers every day starting today. You will learn something today that you can apply the first day you get back to the hospital. So having said that, this first panel that we're going to be having this morning is going to be talking about the ways to maintain academic and intellectual engagement as you go on through your career. You're not just going to be a zombie seeing patients. You may think you are, but you're not. Good doctors are good clinicians, good scientists, and good educators. And in order to be all three, you must remain academically stimulated. Your first academic challenge, your first intellectual challenge after you complete your training will be passing your boards. And Dr. Bartley will be here to be talking about that in just a few minutes. Next slide, please. What we're actually going to do, though, I'm going to give you the bonus information on the boards. This is direct from the board's website. I am old. I took the boards a long time ago. All right. By the way, I am the Academy's oldest young ophthalmologist, if anybody has any questions. I may take frequent bathroom breaks. Please excuse me. All right. The written exams. This is really important stuff you need to know. The board wants to know if you're smart enough to move forward in your career. That's what the writtens are all about. All right. Last year, 501 people took the boards for the first time for the written exam. 501 and 437 passed. Congratulations. 87% passed the written boards. 13% failed. The oral exams, all they want to know, are you safe enough? You've already proven you're smart enough. Now we want to know if you're safe enough. Here's a tip. No matter what question they ask you, even about suprachoroidal hemorrhages, never say the word surgery in the first sentence of your answer. Never, never, never. Always start with good eye exam, ask good questions, informed consent, speak with consultants, and then when they finally are putting the chains around you, say, okay, we might do some surgery, and you can move on with that discussion. Never mention it at the beginning. So they want to find out if you're safe enough. Last year, 468 sat for their orals, 75% passed. So 87 in the written, 75% on the orals. Overall, 65% walked through the door first time and got their board certificate. That's 2 out of 3, all right? 25% failed their orals. They must have said the word surgery in the first sentence of any answer during their oral boards. Bad idea. Here's the data. First-time takers, we just looked at these numbers. What about having to go back? This is what you don't want to do. You don't want to have to go back because not only are you competing with the other people who did poorly last year, you are now competing with all the brand new, smart, fresh people there in the same pool. And it is a very deep pool. And your chances of passing decrease with each successive attempt, okay? So pay attention, apply yourself in the preparation for the boards, and I'm sure you'll all do well. And by the way, all the young ophthalmologists here in New Orleans or in the country are not in this room. Just you guys, and congratulations to you that you decided to take enough time to enrich your careers and make yourselves better ophthalmologists and hopefully better adults as well. So let's get this first panel going. We got 3 docs here, experienced ophthalmologists, going to come up and join me. They have their choice of any of these wonderful IKEA couches up here. All right, and let's have a warm welcome now for Dr. Ehsan Rahimy, Dr. Rahul Khurana, and Dr. Stephen McLeon.
I guess I'll get started. So I guess this panel is about the Academy resources.
Right, but with a particular intellectual focus.
So we will start with for all the things the Academy does, I remain convinced that the Academy really is committed first and foremost to education for the benefit of patients and what we do. There's a real focus on education, so I think that's a great place to start.
Excellent. Gentlemen, others?
I would just like to say, I want to just welcome everyone here. I think you guys it's an exciting time. I want to welcome you to the greatest profession in all of medicine. And how can I say such a comment? Because what we do is amazing. Protecting sight, empowering lives, that's not just a tagline, that's what we do. And so you guys should take a lot of pride in a lot of the work you've done, and it's a very, very exciting time. So I wanted to welcome you guys all personally to the profession, and hopefully we can help you achieve what you want to achieve in your careers.
I'd like to echo what Rahul just said right now too. I just remember being in a lot of your shoes at the stage of end of training. You got the end of all this calls and these kind of things inside, and you're just really excited to start your new job. And then this next, 1 to 2 years is going to be like a remarkable transformation in your life. And
All right,
there's
we'll start with Dr. McLeod then. You've all talked me out of it. All right. You're busy. You're very busy. You're straight out of training. Work. Just beginning to get a grip on your finances. Why do I care about the Academy? Why would I want to spend any time with the Academy? What am I going to get out of being part of the Academy?
So what's really interesting, if you look at other subspecialties in medicine, very few subspecialties have the level of commitment and community that ophthalmology has. A lot of specialties have many different agencies that represent different aspects of the profession. But I think ophthalmology is really, really fortunate in that there is a real community that has been established by the large proportion of individuals who commit to the Academy. And, you have to ask, well, why is it that so many people are indeed committed? And, it's easy to identify quite a few. I'll say right off the bat that this meeting in particular is incredibly valuable for individuals as they move through their careers. The ability to come and meet with your colleagues and friends from other years, to meet professionals and specialists across other areas where you can learn from. That I sound as if I'm selling the meeting. The tremendous resources that go into the educational aspects, and all of this, comes with Academy membership, which is great. I think that, not to go on, don't worry, just a couple more points. Ophthalmology, it's one of those areas where we tend to be pulled outside of House of Medicine, which is a really bad thing. Ophthalmology is not a part of basic curricula anymore. We tend to end up in freestanding ambulatory units. But one of the things that helps to counter that, and I really do hope that this will evolve and we'll move back to House of Medicine, is that it does really increase the premium on the community that we have with each other as a profession. And the Academy is really, I think, a tremendously effective driving force in that respect. And it's really important for us as individual practitioners to have that community.
Rahul, residencies have very structured curricula. We heard earlier, you're told exactly when the lecture is, when your clinics begin, etc. Now you're in free fall. You're out by yourself. How do you develop a personal curriculum to prepare yourself to be an ongoing student and a lifelong learner?
It's a great question. I think you guys have worked so hard, and I think when you're finally done, you're like, just want to take care of patients, you want to move on with life. And I think it's always important to keep the education process going. And I think the Academy really offers a lot of wonderful resources to do that. For me, I like journal articles, and just, I'm a bit of a bias. I'm in charge of the One Network, and there's so many great stuff that's there for you. There's lots of different types of learning, from videos to different types of CME programs. There's over 130 hours of CME on the One Network. So I think what I like is, I'm a very visual learner, and so I like to look at videos, and it's always great to see new surgical techniques. And coming on to online sources such as the Academy has is a great first start to kind of see what's new, what's happening. I think coming to meetings is a great way to socially, it's a lot of fun to reconnect with colleagues. Same time, you can keep up to date on what's happening.
Okay, Dr. Rahimy, any other resources you recommend for young doctors to use earlier in their careers to stay connected?
I think the iWikipedia website has been great. It's really taken off. I think from the time I was in residency, it's really grown. There's a huge, essentially encyclopedia of all these ophthalmic conditions we take care of. The One Network is great. I think a position a lot of you may find yourselves in, which I did out of training, is you lose access to a lot of your journals that you're used to perusing. And for a while I was badgering my former junior residents for their access to get to journals. But actually with your Academy membership, in addition to access to ophthalmology, you get up to 9 other journals. So a lot of these are going to be subspecialty specific, but that's another great way to keep up too.
It's more passive when you're a resident. You learn by the way they show you. You're going to sit for a lecture, you're going to go to this workshop, you're going to sit and assist in surgery, and it's programmed for you. But you mentioned there's different learning styles. So some people enjoy video, some people like reading articles. What about people that enjoy live learning, face-to-face live learning? What's in it for them, and what opportunities are there in their local community as well as nationally? You're in town and you want to go to lectures. How do you find out about where the lectures are in your town?
I think just staying connected with friends. I mean, I've been involved in a number of focus groups or lectures or dinner lectures, and I hear about things from Rahul or vice versa, and always staying in constant communication. I think now we're at the peak of this. I'm always texting, ex-fellows and my former attendings, and this is how you stay constantly communicating, constantly learning. But especially in your local region, this is how I've always found out about lectures, groups, these kind of things to go participate at. And I think there's a lot of benefit in this active learning type of situation.
So direct networking, joining your local society, joining your state society. You're already a member of the academy, so that means you're going to be getting plenty of junk mail and web mail and invitations to all these kinds of events. There's another little secret pearl. I usually don't let it out till afternoon, but you're such a great large group here. I'm going to tell it to you right now. Your local reps, the vendors, the people that sell you eye drops and equipment, they know everything. And they know what your colleagues are doing, they know who's getting paid what, and they know where the meetings are. And oh, by the way, they're sponsoring a couple of them as well. So when you check into your new community, when you begin your practice, do not hesitate to reach out and include in your network every vendor that you can find, because they will serve you. They're in business to serve you, all right? I think we got time for one more last good question.
I'd also
here.
throw in, I think other way to get really engaged is with your local academic university. I was very fortunate, Dr. McLeod let me to kind of come over to UCSF, where I got to, work with the residents, which is wonderful, just to kind of give, to be with them. But at the same time, you have access to grand rounds and other things that are there. And I think if you're in private practice, it's really nice to be engaged. I mean, we're part of a wonderful profession and a wonderful community. And I think engaging locally with your local university is a great way. I think nationally, through the academy is a wonderful way, and through your state society is really important.
Research shows the number one way physicians like to receive CME, even in 2017, that's continuing medical education credits, is print. That is reading journals and reading books, etc. It's the number one way they like to get their peer-reviewed expert information, all right? Maybe the three of you will each share how you like to best learn about something. I want to look something up. I want to see it maybe for the first time, or I want an update. Dr. McLeod, what do you do?
Look, I can't help it. Look, I'm a journal editor. I go to the journals. Now, not all journals are created alike, and I think that now is a time, sort of when you're getting through training, that I think you're in an environment where people are really pushing critical thinking, and there may be a temptation to sort of get to the shortcut of, okay, what are the last three things that someone did, but I will always encourage there's a good reason for the randomized controlled clinical trial. Anecdote is great, but really being very critical about how you assess the new data that's pouring out is going to be really critical as you move forward through your career.
Dr. Rahimy.
I mean, I'd take it one step further. What Dr. McLeod just said is not all journals are created equal, but at the same time, not all material in every journal is created equal either. So just because something says it's peer-reviewed, I actually always encourage people, you should be your own critical thinker. Doesn't mean just this is peer-reviewed, this is in this journal, that it's truth. So you have to always be constantly thinking about this kind of stuff. And what I usually do is, I have my own subspecialty journals. I like to peruse online, always looking at what's out in press, what's just hitting online first. Read through those abstracts, see what catches your attention, something that may be pertinent to you, then you dive deeper, and then actually go ahead and read the whole article. So,
Rahul?
Echoing what Stephen says, I prefer journals, but I do think there's a lot of value in going to meetings, there's lectures, there's talking to colleagues. Some of the best conversations I have are just talking with colleagues on various ideas. So I think being engaged with your profession, with your community is really important. And I think it's really a combination of all. I tend to favor journals, but there's so many different avenues, and I think it's important to find the right combination.
You've all been wonderful. You've helped launch this program. Give them all a warm round of applause. Thank you very much.